as to how well your gastrointestinal, your digestive system is functioning. And you can see it has low priority, moderate priority, and high priority, and we grade you based on some of the questions that you answered. So that's something that I would encourage all of you to fill out, because your digestive system, as we're going to see here, has a lot to do with how your immune system is working. So that's why this is so important. We're going to talk a lot about your gut. So very good stuff. There's another one here called Gut Dysfunction and Chronic Disease. What this is a one-page summary of a paper that was written by some of the representatives and the researchers that work for the Metagenics company that we get a lot of our supplements from. And what it talks about is the 4I GI restoration program. And the 4 R's it goes through and describes all of them and what they do for you. And we'll talk a little bit about that as we go through the presentation as well. The last handout that says artificial versus natural immunity on the top. I'm going to talk a little bit about vaccines as we go through. I'm not going to hit on them very hard or hammer them into your head, though, because I want you to make good, informed decisions for yourself. Okay? I'm going to give you some of the research, I'm going to give you some of the science behind it, and then you can kind of make your own decisions from there. But it definitely has some information on there, and also some resources for you at the bottom of the page. The National Vaccine Information Center, Dr. Eisenstein, Dr. Mercola, and also the CDC webpage you can go to and look at some of these things. So just to let you know about some of the resources that we have. When this seminar here is over for the end of the day, for the end of the talk, there's a few supplements here set out. I also have a booklet that talks a little bit more about the 4R program. And if you have any questions, Dr. Lindholm and I will both be around here to answer any questions that you might have. And talk through some things, any issues that you would like to discuss. So with that, we will go ahead and we'll get started. So boosting your immune system, looking beyond colds and the flu. We're going to look at a big picture of immunity and how the immune system works. So I want to talk to you about the importance of the immune system, what really makes up the immune system, some of the cells, some of the tissues, the dysfunction that can occur in the immune system. We'll talk a lot about that. And also, how can we optimize our immune system function? I know that's why most of you are here. So that's really what I want to cover with you. I was telling Dr. Lindholm before the presentation, I have more of a left brain know the facts type of mentality, but I'm going to present it to you with the facts, but I'm going to bring it around and put the big picture together. So stick with me. We're going to talk a little bit deeper, a little bit about the science behind it, but I will make it as understandable for you as possible, and I believe you'll find it very interesting. So, my goals: to take a very complex system. The immune system is one of the most complex systems in our body. Our bodies are just very complex to begin with. That's how we were created. But hopefully I'll make it a little bit more understandable for you. You know a little bit better what's going on with your body's defense mechanisms. Also, I want to show not only how the immune system gives resistance to infection, we're also going to talk about other disease processes like autoimmunity and cancer, and how the immune system works to defend our bodies and our tissues against these as well. And then here you can see I underlined and bolded this. I want to increase your risk of staying healthy for life. I don't want to see you not just decrease your risk of getting sick, but I want you to think long term here about how well you can get and how being the best you can be. So, important functions of the immune system. The basics behind the immune system is it cleans up the mess. Anything that comes into our body, it kind of takes care of it. If it's not supposed to be there, it gets rid of it. It should get rid of it. We look at, this is the one thing that most people think of, elimination of invaders. So I have a couple pictures over here for you. Some of these look very undesirable. You don't want them around in your body. Bacteria, we have some viruses here. Fungi that can grow within our bodies. And these are the ones nobody wants to have, parasites. Nasty, nasty little boogers. So these are a lot of things that we're exposed to that shouldn't be a part of us. So, and this is what a lot of people think of when they think about immune system. It is a very big part of it, but our immune system goes further, and it eliminates abnormal cells. Any cells that shouldn't be in our body will recognize and destroy. It's a very, very innately creative type of process that occurs, and we'll talk about it. So if there's any dead tissue, like after we have some sort of injury, the body's going to go in and it's going to take up that tissue so that it doesn't keep on being a thorn in our side, so to speak. So products of inflammation. So many processes are going on in our body on a daily basis that are causing us inflammation. And if we don't have an immune system to go in and clean it up, they're just going to stay there and stay there and stay there. We can develop things like autoimmunity. We'll talk about that, like I said. Cancer cells, obviously, some other types of abnormal cells that accumulate within our body. And also infected cells. The mechanism behind most viruses is that they actually put their DNA into our cells. The body's like, no, this is not good. We're going to take these infected cells, we're just going to destroy them. We don't need them anymore. They have viral DNA. We don't want that. So it'll take care of those infected cells or any bacterial infected cells as well. Preservation of cell tissues. I put an asterisk here. Our body knows what belongs there because of things called antigens. An antigen is essentially a tag on our cells that says, I'm supposed to be here and I belong to this person's body. When people have transplants or different things like that where they're having outside tissues put into their body or anything else is being put into their body, the body's immediate response is to try and get rid of it. That's why they have to give people immunosuppressive drugs like corticosteroids when we do transplants, because they don't have correct antigens. Also why you have to be careful with your ABO blood typing. Antigens on the blood cells will cause it to coagulate if it's not the correct antigen. So it will eliminate cells that don't belong, non-self cells, and it will preserve the self cells. And that's a really interesting process that actually takes place when we are first born, within the first few months of life. Is really when this happens. So you can kind of see this is a little illustration of it. We have an antigen with different binding sites. I know it's kind of hard to see, but each of these has a little bit different formation. And depending on which antigen is on our cells, we can have potential antibodies that will come and attack it. We'll talk about that here in a little bit. So we talked about some of the functions of the immune system. Now, what really makes up our immune system? What are the components of our immune system? How does it all work together? What I first want to cover with you is innate versus acquired. Innate means that we are born with it. We don't have to do anything to get it, versus acquired where we have to perform some sort of action. We have to have some sort of exposure to it. Innate immunity entails things like barriers, which we'll talk about here in a little bit. I'm just going to kind of rush over them real quick. Body surface secretions, inflammation, just general inflammation throughout our body, specialized immune cells and their secretions. And this innate is usually used in the initial time that we encounter something. So the first time you're exposed to a virus or a bacteria, everybody knows that once we're exposed to something, naturally, we have immunity to it for the rest of our lives, right? This is really what takes care of that, because we have this initial exposure and the body creates memory from it. Then we have acquired immunity, where we have more specialized immune cells, and their function is to create antibodies. Those are a little bit more specific for after we've been exposed to something. If we have another time that we are exposed to it, if we have say we have like a strep infection, the second time we get the strep infection, the body can respond a lot quicker because it already has antibodies and it can kick them out a lot quicker. So this is the way it should work, okay? Initial exposure should be through innate, and then secondary exposures or repeated exposures, our acquired immunity should take care of, although there will be some innate that will take care of it as well. This kind of just shows some of the cells. So I'm not going to really explain it much to you. We're going to talk about these cells a little bit more in depth. These are our lymphocytes over here, more of our acquired immunity. These are more of our granulocytes, things that are going to go around and just gobble up the pests that get into our body. So the general organization of our immune system is we have our barriers and our secretions. Then we have our lymphatic system. We have our white blood cells, specialized tissue cells, and then different chemical factors, which we're going to talk about here. So barriers. I told you I was going to talk about your gastrointestinal system, your digestive system. The major one is skin, covering all the surface of our body except for some of the different orifices that we have. So skin, very important. When we start getting cuts in the skin, that's when we can start getting things passing through and starting to activate immune responses. Like I said, we have intestinal. I put an asterisk here. It's very, very important. We have our good bacteria, our microflora that live within our gastrointestinal tract. And then we also have a mucosal barrier, which is really the cells and the secretions. And this is really very interesting because the gut actually gives us internal sensation. It gives us the ability to know what's going on inside of us, and there's lots and lots of nervous system that is dedicated just to our gut and communicating with our brain and our gut. So I put here, strongly ties in with the nervous system. They estimate that, I'm trying to remember, it's 100 million neurons are just within your gut and your intestines. The only place that has more than that is your brain. So we're looking at, it has more than your spinal cord, it has more than your spinal nerves. That's how much communication occurs between our gut and our brain. Those of you who are patients here know the importance between the brain and what we work with in chiropractic, activating the brain, make sure it's working the way it's supposed to. So you can see if we have some breakdown in this barrier, how this could be a problem with not only affecting our immune system, which 70% of our immune system is located in our gut. 70%, that's huge. So it's very strongly tied in with our nervous system, very strongly tied in with our gastric function or our digestive function. It all goes together very tightly. We also have respiratory barriers, so within our lungs. We also have a blood-brain barrier, so that things can't just cross into our brain. If we had that happening all the time, we would all be walking around big mess, huge mess. So when we start getting holes in our blood-brain barrier, we can also start having a lot of problems. And as the gut goes, often the blood-brain barrier goes. So that's why it's important to keep them both very healthy. We look at secretions, things like stomach acid, which is very low pH, very acidic. So it's going to kill most bacteria that get in through our digestive tract. But we also have saliva, which would be the first thing it would encounter. And there's lysozyme in there, which is going to break down these different invaders. And also we have mucous membranes. You think about all the mucous membranes you have in your body. A lot of it's within that digestive tract, but also in the genitourinary tract, and some of the respiratory tract as well. And all these are secreting something we call secretory IgA, which is part of the antibody of system. So SIgA is a very important part of our mucosal immunity. And then also tears, and people don't think about that a lot. The lipase enzyme in there that will break down different membranes in the cells that we encounter. So this is just a little picture talking about good intestinal function versus bad intestinal function. This is what we want over here. You can see we have nice cells here. We have good villi here, which are the kind of the absorbing portions of the digestive tract. We look over here, we got huge gaps in between the cells. We have fungi overgrowing, we have toxins going through the different holes in the cells, and the junctions between the cells are very loose. So we have a lot of stuff that's able to get through here and get into our circulatory system that normally a good digestive system would keep out. So that's really what I want you to get from here. Healthy, not healthy, all kinds of stuff leaking through here, causing bad reactions in our body. The lymphatic system. The lymphatic system cleans the interstitium. What the interstitium is, I know it's a big long word that doesn't make a whole lot of sense. It's the area between all of our cells. There's little areas in between all of them. And it actually makes up 1/6 of our body. So it's a very large aspect of our body that needs to be cleaned out. So this is where we develop lymph and lymphatic fluid flow. People that get a lot of edema or swelling in their legs, a lot of times they have blockage of these different lymph channels. And what can happen is then you get stasis, you get things just kind of hanging out down there that aren't getting up through circulation. So this runs with our arteries and our veins. It's going to bring the lymph to lymph nodes, which is where things are going to be broken down, where bacteria are going to be marked for destruction. So they're going to come into the lymph nodes. Also in the lymphatic system we have the thymus, the spleen, and the tonsils. And these are all just kind of specialized lymph nodes that are going to provide more specialized support to destroy certain bacterial and viral invaders. You can kind of see the breakdown of how this happens. This is throughout your body. Just everywhere, like I said, it follows along with all your major blood vessels. So it's a very important part of the immune system and other body systems as well. This is a big word up here, phagocytosis. We're going to talk a little bit about this, so I wanted to introduce the concept to you. This is really, really interesting stuff. You think about I'm exposed to this. What does my body really do? This is what your body does. It has this little bacteria here, and we have these specialized cells, which we're going to talk about here